and hope you're doing well, staying safe today. Want to thank eCancer and OncoAlert for the opportunity to discuss a couple of interesting presentations during the 2020 virtual ESMO. It was a terrific meeting, very well done, and kidney cancer was actually well represented. I want to first start by a study by the name CheckMate 9ER that was part of the plenary session. This was a randomized phase 3 trial of the combination of cabozantinib, the tyrosine kinase inhibitor, with nivolumab, the PD-1 inhibitor, versus standard sunitinib in all risk groups. The primary endpoint was progression-free survival, and it was doubled actually from 8.3 to 16.6 months. And in addition, and most importantly, the study showed a response rate that is double with the experimental arm, and an overall survival benefit with a 40% decrease in the risk of death. The toxicity were manageable, and the treatment discontinuation due to adverse event were low in both groups. Interesting, in this trial also, patient-reported outcome were presented, and actually quality of life questionnaire using the FKSI-19 and FKSI-DRS favored the combination at almost all time points, and this was statistically significant. So soon, we may be having another option for metastatic renal cell cancer patient, which is really very refreshing. A couple of other presentations that, caught my attention. One is actually a study with cabozantinib, also based combination, but with the PD-L1 inhibitor atezolizumab, from Dr. Pal and Dr. McGregor. The first study in clear cell RCC using the dose of 40 milligram or 60 milligram. With both, the responses were over 50%, over 90% of patient had shrinkage. And again, the combination was tolerable, and both the combination of atezolizumab and cabozantinib now are moving into a trial by the name CONTACT-3, which is a randomized phase 3 trial in the post-IO setting. And close to that, actually, Dr. McGregor from Dana-Farber presented the same combination, cabozantinib, atezolizumab, in non-clear cell RCC, which is an unmet medical need, showing a response rate in the range of 30%, and again, tolerability. So, these are also good news for patients, how things are progressing. Another abstract that caught my attention was an abstract by Dr. Zengin from City of Hope, mentored by Dr. Pal, actually. And it was the largest assessment of circulating tumor DNA in metastatic RCC, over 800 patients. And it validates previous finding that we can detect circulating tumor DNA, and in kidney cancer, this is a tumor that doesn't shed a lot of DNA. Despite being rare, there are some actionable genomic alteration, such as MET, BRCA1, 2, EGFR were found. And interesting enough, they did a concordance analysis that suggested that both circulating tumor DNA and tissue-based genomic profile can be complementary, because some genetic alteration were seen in the blood, but not the tissue, and vice versa. So I think this is refreshing. And finally, I want to touch base on a French trial by the name Bionic. And this is a trial where patients were looked at initially and selected based on their biomarker status. And I wanted to highlight this study because we know that these are very, very difficult to conduct studies, but kudos to the authors, who were able to work on a study like this. So it really paved the path towards biomarker-based prospective clinical trials. So again, I want to thank eCancer. I want to thank OncoAlert and all of you for listening to the updates of kidney cancer during ESMO 2020. was a terrific meeting. And thank you very much.